From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to our listeners from around the world. I'm Dr. Tracy Lieu, Deputy Editor at JAMA, and a pediatrician and researcher at Kaiser Permanente. Today, I'm very pleased to welcome Dr. Alyssa Bilinski, author of an insightful new editorial in JAMA titled Abortion May Be Controversial: Supporting Children and Families Need Not Be. Dr. Bilinski is an assistant professor of health services, policy and practice, and biostatistics at Brown University School of Public Health. Her work involves policy modeling for maternal health and infectious disease. Welcome, Dr. Bilinski.
Thank you so much for having me.
The impetus for your editorial was a pair of papers recently published in JAMA describing abortion bans that were implemented in 14 states and the subsequent changes in birth rates and infant mortality. These papers were led by Drs. Suzanne Bell and Alison Gemmell at Johns Hopkins University and their colleagues, and they were titled U.S. Abortion Bans and Fertility and U.S. Abortion Bans and Infant Mortality. Can you give us some context? Why are the effects of abortion bans important to study at this time?
So, as I'm sure most of your listeners are aware, in 2022, the Supreme Court overturned Roe v. Wade, which was a 1973 precedent that had established abortion access as a national constitutional right. With that overturned, decisions about abortion policy returned to the states. And as you alluded to, by August of 2022, 14 states had enacted complete or 6-week abortion bans. We have a lot of reasons to think that abortion bans and restrictions have pretty profound impacts on people's lives. But with any policy, it takes time, both for those effects to be felt and for us to amass the data to rigorously quantify them. With that data now newly available, these authors were able to study the impact of abortion bans on the two outcomes that you mentioned, on births and on infant mortality.
Can you tell us a little bit more about the data used and what these studies' key findings were?
Sure. So for these studies, the authors first collated information about births and deaths routinely collected by the Centers for Disease Control and Prevention and posted publicly. And they combined this with information about the enactment date and location of abortion restrictions that were implemented across different states. All of this was fed into a Bayesian observational causal inference model, which is a way of estimating the impact of abortion bans in these states that had implemented restrictions. And although I won't get into too many technical details, this approach involves imputing or estimating a counterfactual for what would have happened in states absent restrictions, using both data from states that didn't have abortion bans and pre-implementation data from states that ultimately enacted abortion restrictions or bans. The authors also performed pretty extensive model specification and robustness checks to make sure that their results were not sensitive to minor mathematical details. And after all of this, they found significant effects on both outcomes. First, that abortion bans led to a 1.7% relative increase in birth rates. That's about 22,000 excess births, and these effects were concentrated among Black, Hispanic, low-income, young, and unmarried women. There was also a 5% relative increase in the infant mortality rate. So this is about 500 excess infant deaths, and those effects were concentrated among Black individuals, people living in the South, and babies with congenital anomalies.
Your editorial goes beyond these two studies. It highlights related state and national policies that affect children and families. The child tax credit is one policy that you think may have some promise in the next few years. Can you tell us more about it?
So before I get into that specific policy, I just want to acknowledge that there is far more to be said about these results and the broader policy issues than we can possibly cover in this short podcast. And I really want to make sure that I acknowledge that in a polarized national conversation about abortion, there are going to be very different perspectives on these findings. These studies cannot resolve fundamental disagreements on abortion. But amidst larger abortion debates, I really don't want us to lose sight of potential common ground. And I think these papers shine light potentially on an imperative to focus on the children who are most affected by abortion policies, who are often born in low-income and vulnerable settings. I think we can agree across ideological lines that all children and families deserve an opportunity to thrive and the support that they need to do so. So then the question that I was looking to answer in my editorial is, what does this look like in practice? And to the specific policy question that you raised, I think expansion of the child tax credit can be a really important part of this. So as families are struggling with the cost of living, we actually have a tried and tested intervention to reduce child poverty, which is expansion of the child tax credit. For background, as part of COVID-19 relief, the child tax credit was increased substantially, nearly doubled for some families. And as a result of this, child poverty reached a record low of 5%. Since the expansion has ended, child poverty has resurged. But there remains some bipartisan support to re-expand the child tax credit. And in particular, I'll note that Vice President Vance has repeatedly discussed this and proposed even expanding the child tax credit beyond what we saw as part of COVID-19 relief. So this is a potential area for bipartisan cooperation that would really have a meaningful impact on American families.
Let's think more now about health. And, it's particularly notable that Medicaid provides health insurance to more than 1 in 3 U.S. children. What are some of the current policy developments we should be watching for in Medicaid?
So I think it's important to keep in mind that right now we have seen across the board that policymakers are looking toward cutting budgets. And in that context, I think it's really critical to highlight the impact and importance of a robust Medicaid program. We have decades of research suggesting that early childhood health is an area of investment with some of the highest rates of return. We know that health insurance is particularly critical during the prenatal, postpartum, and early childhood periods. And so I think the most important thing to highlight about Medicaid is that any cuts to Medicaid really run the risk of being penny wise and pound foolish in terms of long-term health and well-being.
Looking in a more focused way, in your editorial, you mentioned the importance of policies that affect the well-being of healthcare professionals in states with abortion bans or in other states that feel the effects of such bans. Can you tell us more about the policies that you were alluding to?
Sure. So clinicians right now are caring for patients in states with abortion restrictions every day, and by all accounts, these restrictions have a lot of implications for practice. But in our short time here, I want to highlight one in particular, which is that there is a critical need to help clinicians navigate obstetric emergencies for which offering termination is the standard of care. Not because a pregnancy is unwanted, but because of severe maternal health risks when there's really no chance of fetal survival. So, for example, when a patient experiences preterm premature rupture of membranes, which is water breaking far before viability, the Society for Maternal Fetal Medicine recommends offering termination due to the risk to the pregnant person of sepsis, hysterectomy, or death. But clinicians have actually really struggled to clarify exactly when these exceptions to abortion bans apply, because they fear significant repercussions if they misinterpret the law, including investigation, prosecution, and if they're found guilty, even life imprisonment. On the other hand, there have been really tragic results of delayed care. I don't think these outcomes are a necessary or acceptable cost of abortion restrictions, and there are a lot of steps we can take to ensure that adequate care can be provided in these rare emergencies. This can include interventions like adding clarity to statutes and guidance through state medical boards, as well as ensuring that healthcare systems provide guidance, support, and education for physicians and other clinicians making these decisions.
Dr. Bilinski, what do you think are some of the key take-home messages for the clinicians among our JAMA listeners?
So, the key takeaways for clinicians are that in a post Dobbs world, in a nation where 19 states currently have some form of abortion restriction, including many with the complete or 6-week ban studied here, we're seeing both more children being born and more children being born in higher risk situations, leading to increases in infant mortality. This means that it's important that clinicians have the resources to make sure that they can provide care for people experiencing these pregnancies and mitigate adverse outcomes as much as possible. That we have broader support and policy tools to ensure that all of these children and families have the ability to thrive, and that we work with clinicians to make sure that they can continue to provide the highest standard of obstetric care throughout the country, even in emergencies where termination may be required. The last thing I want to highlight is that I don't think we need to solve national disagreements about abortion in order to collectively agree to support children throughout the country. I don't think we need to resolve these contentious debates in order to figure out policies that can have positive outcomes for the people affected by changes in abortion laws. And so my hope is that even as people have divergent reactions to these findings, we can still find common ground to pursue policies that improve outcomes for women, children, and their families today.
Great. Well, thank you so much for the overview of these important studies on abortion bans and your thoughtful editorial on the policies that affect children and families. I'm Dr. Tracy Lieu, and I've been speaking with Dr. Alyssa Bilinski about her editorial in JAMA titled Abortion May Be Controversial, Supporting Children and Families Need Not Be. You can find a link to the editorial and the related articles in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Morrow at the JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.